Anna.
Thank you very much. Good afternoon, everyone. I'm really happy to see so many familiar faces here and so many new faces. Um, we've had terrific scientific presentations today, in my opinion, and for that reason, I was asked to do something a bit more personal. So I was asked to tell you about what living with Fabry has been like for me, and I will be sharing with you the story of my life, my family, our road to diagnosis, to treatment, and beyond. As I am a big believer in sharing experiences and thoughts among patients and other Fabry affected. So first I will introduce my family to you. We are originally a family of 4 from Finland. On the map here you see Finland. It's one of the Nordic countries, and it's neighboring Sweden, Norway, and Russia. My family is originally a family of 4 from the southern part of the country, the Helsinki capital area. There are 3 patients in the family: my mother and her 2 children, my older brother, and myself. Fabry has always been very much a family affair for us, because obviously also my father has been affected by it very much. I enclosed here a picture of the latest phenomenon from Finland that you might recognize, the angry birds. I find that in many ways my family has been like the angry birds in the past, angry about no diagnosis at first, then angry about no or lack of information, and then angry about no treatment. Nowadays we are less angry, but we still sometimes get angry about things. We got our diagnosis 17 years ago in 1996. When things were very different in Finland. But luckily, there are also 2 healthy grandchildren in the family, my brother's son and my daughter. My nephew is now 17 years old, and my own daughter is 9. They are both Fabry-free, so they are the next generation, one more reason to be less angry at the moment. To begin the story of Fabry in my family, I will take you back about 35 years when my brother and I were children. I was very much the adoring little sister to my older brother, as you can possibly see in the picture. During our childhood, my brother and I started having pain in our extremities, which we now know is called acroparesthesia. The pain usually appeared in connection to the body temperature changes. You can imagine Finland was a difficult place to live because of the freezing cold winters and our very interesting pastime, the sauna. In addition to the acroparesthesia, we both had lots of gastrointestinal problems as teenagers, as well as a lack of normal perspiration, which caused a risk of our bodies overheating. You can imagine taking a sauna, for example, was quite uncomfortable. Although we share many of the same symptoms, they were always much more severe for my brother. We also experienced fatigue from time to time, which I called at least the gym teachers at school calling laziness. At the age of 15, my brother was hospitalized for several months because of ongoing fever. His blood samples indicated a bad infection. I wasn't allowed to visit him at all at the hospital, so I only saw him during the occasional weekends when he came home. I still remember noticing the strain that my parents were under during that time. Simultaneously, my brother discovered the first signs of a skin rash, angiokeratoma, on his stomach and genital area. You can imagine it was a great concern and embarrassment for a teenager. The treating physicians were puzzled. No diagnosis was made at the point. At the age of 27, my brother completed the compulsory military service in Finland. And this is not a picture of my brother, but you can see in the picture, you can see the amount of equipment that the young boys carry around the forest during the military service. During the service, he developed very severe pains because of the strenuous exercise and was hospitalized on several occasions. There were also the first signs of serious kidney problems then. All kinds of examinations were completed, but there was always a dead end in the diagnosis. The best guesses from the doctors were some form of rheuma or rheumatic fever. In the summer of 1996, at the age of 30, my brother visited a recommended neurologist in Helsinki, who explained that the easiest part of the human body to examine the nervous system are, in fact, the eyes. She referred him to an ophthalmologist for a full eye examination. That is where a characteristic change on the cornea of the eye was found, and that led to diagnosis. The diagnosis was verified by blood samples sent to a Swedish laboratory at the time, because none of the Finnish laboratories were doing the blood tests in the 1990s. My brother was soon after diagnosed with a severe kidney condition as well, which is typical to Fabry disease. After the initial diagnosis of my brother, also my mother and I were diagnosed with Fabry. Then what? We were living in the year 1996. The world was a bit different back then. There was very little knowledge of Fabry disease in Finland. There was absolutely no patient support available. Luckily for us, for my brother and myself, there was the internet. A new phenomenon, not the internet that we know today, but something that we could search into and we could find information on. In 2003, a meeting was organized in Finland where we met other Fabry-affected families for the first time. It felt very amazing to discuss the symptoms and feelings about the disease with an outsider of our own family. We all expressed the need for more patient support as well as the patient advocacy. There was a mutual decision to establish the Finnish Fabry Association. During the summer of the same year, my brother was invited to participate in a research project on enzyme replacement therapy at the Turku University Hospital in Finland. There was great diversity at the time between the different hospital districts in Finland on how they perceived the reimbursement issues for ERT. So there was a lot of injustice, in our opinion. In 2005, we decided to file a complaint to the Finnish Parliament about the situation in Finland, and the parliamentary ombudsman published a decision stating the equal rights for all Fabry patients in Finland to receive ERT if the medical criteria established was filled. Nowadays, I guess our next challenge is that the search for undiagnosed patients continues. Returning back to my family. Although my brother was benefiting greatly from the ERT in other Fabry-related symptoms, as well as his overall medical condition, his kidney problems were too advanced and kept on developing despite the ERT. He ended up with kidney failure. In December 2009, he started with peritoneal dialysis to prepare him for a kidney transplant. We'll go fast with that picture. I know it's ugly. Already in September 2010, my brother got a phone call that changed his life. A new kidney had been found. In total, he spent only 4 months on the transplant wait list. Now, 2.5 years later, things are going well for him. He's back at work full-time and enjoys spending time with his family. He continues with ERT every 2 weeks. There have been several ups and downs for him in the past years, but he considers himself to be the lucky one. Some people wait for a new organ for years and years. Then the case of my mother. My mother is in her 70s at the moment. I know, there's my mother, there's also my little girl who can't stay away from the camera when somebody's taking pictures. My brother, so she's in her 70s now, and she received this diagnosis at the same time with us. So she was, in fact, in her 50s when she received the diagnosis. She's lived most of her life without a proper diagnosis and has been accused of being a hypochondriac, among other things. Her father passed away before our diagnosis, but it is assumed that she inherited the disease from him. She has multiple health issues and a heart condition, and she has been on ERT for 4 years now. What about my own health? That's a very sensitive topic for me. Things have been very good so far. I've been able to live my life in a very normal manner. I worked full-time, although very recently I went from the corporate world to teaching to reduce the stress levels, so I guess I'm learning something slowly in my own life as well, and enjoying the 10-week summer vacations. I'm able to do sports. I do a lot of volunteer work. This is actually a drawing of me in Moscow last year at the Eastern European Rare Disease Conference. It's drawn by one of the interpreters at the event. She wanted to make a drawing of me and then give it to me as a present, which I thought was lovely. Obviously, my greatest achievement is my 9-year-old daughter. I had kidney problems for the only time in my life during my pregnancy when I developed proteinuria, but nothing since then. Now, I've always shared some of the symptoms of my brother: fatigue, intestinal problems, vertigo, periods of pain, and lately also hearing loss. In the recent years, there have been some signs of heart problems, so starting ERT has been discussed as a preventive measure. To conclude, living with a chronic disease is not always easy. In addition to the physical problems, a disease that affects the whole family can be mentally very challenging as well, both to the patients as well as other family members. The amount of guilt that patients feel about inheritance issues can be enormous. Life with a rare chronic disease creates several challenges in everyday life. Also, appearances can be deceiving. Fabry patients seldom look unwell, which can be a blessing in some ways, but a real obstacle in others. People around us can't understand that there could be something wrong with us. The disease automatically also affects the way we look at at ourselves and the way we act around other people. The support groups are of utmost importance. We all need to get in contact with other people, other patients, other affected people, in order to get the peer support, information, and help. Sharing our individual stories and experiences provide us with the best possible non-medical remedy, in my opinion. Thank you very much for your attention. Should I put...
Well, that was very personal, but enlightening, very enlightening.
Yes.
Do we have any questions for Anna?
One question.
Yes.
Anna, you said for preventative with preventative measure in mind to start ERT treatment. Do you think it is something, or you have some test results, etc.?
I have some test results that show that the LV levels, I mean the left ventricular mass in my heart has starting to grow, but at the moment they are still at a very normal level. So what my treating physician said that if I was a non-Fabry patient, it would not be of concern at the moment. But since my mom has a heart condition and I'm a Fabry-affected person, then it would be a very good place to start the enzyme replacement therapy.
How many patients are there in Finland in your association?
We have 44 patients altogether, and a lot of undiagnosed cases. The problem in all of Scandinavia, all the Nordic countries, is that the north parts of the country are totally underdiagnosed because there's almost nobody living there. I mean, there's like huge pieces of land and very little people, so it's very difficult to make diagnoses there.
And the center is in Turku.
Turku, yes. Dr. Ilkka Kantola, who most of you physicians know.
Thank you.
Thank you.